and welcome back to my channel, Primal as a Mother. In this video, I'm going to be discussing the processes and possibilities of choosing a care provider that's right for you during your pregnancy and upcoming birth. My name is Destiny. I am the mother of two. I have one more on the way. I've had two all-natural, unmedicated childbirths, and I worked as a birth doula. Birth is something I'm very passionate about. I also have a lot of education regarding the subject and would love to share with others. So here we are. If you find that you enjoy this video, please like it and subscribe. And don't forget to hit the bell so you'll be notified when more empowering videos just like this one are uploaded. You can also follow along with my own pregnancy journey. I'm currently in the first trimester, so we have a ways to go still, and I would love to share that with you. Let's get started. So in this video, I wanted to talk about the options you have in regard to choosing a provider for your pregnancy and upcoming birth. Of course, choosing a provider can be an exciting time, which is one more exciting thing as part of the pregnancy journey. It can also be stressful, just depending on what type of experience you're looking for, and maybe even based off of uncertainties that you might have at the time when you're choosing a provider. So I just wanted to talk more about options, and the whole idea is to educate you so that you're able to make an informed decision and choose the right provider in order to have the birth and the safe experience that you've dreamed of. And being completely honest, when you think about it, a care provider literally can hold the power to either empower you and make you excited and encourage you and make you look forward to your upcoming birth. But at the same time, they hold that same power that can be used negatively. Maybe they've instilled fear in you, or they haven't reassured you. Maybe you feel indifferent, or maybe even powerless when it comes to being able to make choices for yourself and for your upcoming birth. So in this video, I wanted to talk about the differences in different care providers, whether it be an OBGYN or a midwife, and the different types of midwives that you have to choose from as well. And the whole point, again, is just to educate you so that you know your choices and you know your options, and there you can make an informed decision and find the best provider for the type of experience that you're looking for. And that can look different for everyone. So we'll start by talking about an OBGYN. OBGYN is just an abbreviation for a physician that specializes in obstetrics and gynecology. So these are medical doctors who have undergraduate degrees and then went to 4 years of medical school and then continued on with years of additional residency training and specialty training in their specialties. So an obstetrician is a medical doctor and trained surgeon who specializes in delivering babies, and a gynecologist is a specialty physician who is trained to diagnose and treat conditions of the female reproductive organs. So an obstetrician gynecologist or OBGYN is going to be working in a medical setting, like a hospital setting, to deliver prenatal and birth services to women. So an OBGYN is functioning under a medical management model, which is used to test and monitor women to look for conditions or complications that may arise during a pregnancy. They can treat high-risk pregnancies or refer you out to additional specialists if you need while pregnant, but they are essentially testing for things during your pregnancy, monitoring things closely during your pregnancy, just to look out for any abnormalities or complications that may come up. So this is a very medical model of care. Okay, so on the other hand, we have midwives, and depending on the type of midwife you hire, it's important to note not all midwives are the same in regard to training. So depending on the type of midwife you hire, their training and their expertise is going to look a little differently than another. So midwives can work in a variety of settings, and this will also depend on what type of midwife you hire. So midwife may work in a hospital setting or a birth center setting or even a home birth. Midwives function under a model of care that's a physiological model of care. So they believe that women know how to give birth. It's a biological, primal, innate process, and women and babies' physiology knows what to do in order to have positive outcomes in the end for everyone involved. A little bit of a difference is they don't always test or monitor as much as an OBGYN would, and that will differ amongst midwives as well. There are some midwives that do the same tests as an OBGYN would do. So I mentioned the different types of midwives and the differences in their training and experience. Depending on the state where you live and the laws surrounding midwives, you may only have certain types of midwives available to you. In the state where I live, we have all types of midwives available to us. So that can range from a CNM, which is a certified nurse midwife, to a lay midwife or traditional midwife. Lay midwife or traditional midwife, they would have experience from real life experience, attending births, doing apprenticeships. They're not going to be formally trained with a medical background necessarily. So they're not certified. They're midwives. If you think back to the beginning of time, like in the olden days when they had the midwife come out and they delivered the baby at the home, that would have been a traditional midwife. And then on the other side of the spectrum, we have like a certified nurse midwife who usually would work in a hospital setting or a birth center setting. There are home birth CNMs as well, but a CNM is just a certified nurse midwife. They have a background in nursing, medical training, and personally speaking, I'm not going to say that one is better than the other because that's going to depend on each individual midwife's experiences, their philosophies, their beliefs, and if they align with what you're looking for. What vision do you have for your birth? What are your own beliefs? For me personally, I think that birth is a very primal, innate, private event, and that my body knows how to do it and when to do it and what to do, and I don't need anyone's help to do that. So for me, a lay midwife is what I would prefer because I feel they are more hands-off, and that's not always the case. That's just more of a generalization. I don't feel, in my opinion, that birth is a medical event, so therefore I don't feel I need a midwife that has medical training or I won't say medical training. Obviously, you want your midwife to know like CPR, neonatal resuscitation, what to do with excess bleeding, things like that. They need to have that training, and lay midwives can have that training. Of course, they're learning from other midwives. They're attending hundreds of thousands of births. So it's important just to ask questions and figure out what your midwife knows, how they were trained, how they were certified, if they were certified or licensed. But back to what I was saying is I don't feel that I need someone who has a medical degree or a nursing degree at my birth because this isn't a medical event, if that makes sense. So a lay midwife, in my opinion, is my preference, and that may be different for everyone. I also won't say that lay midwives are always as hands-off. There could be a certified nurse midwife that has the same beliefs that is just as hands-off and intervention-free. So it really just depends on the individual midwife and their beliefs, and figuring out what yours are and seeing if they align together. I like a hands-off approach during my birth, and during pregnancy I do very minimal, if not zero, testing. During my pregnancy, because I feel like I listen to my body and I would know if something's wrong and we need to then look for things that are wrong. And this is something that is your individual choice. It's important for you to educate yourself and listen to your own body to know what you feel comfortable with, and then make educated, informed decisions from there with your care provider. So for me, once again, that's minimal to zero testing during pregnancy, very hands off, zero intervention during birth, and I feel like a lay midwife would give me that. But again, that is a generalization, and it could be a CNM that gives that to me. It just kind of depends on who's in your area. In my area, I feel like the CNMs are more medically inclined, and that's not what I'm looking for. So it just depends on what is available to you, and personalities, knowing what you want and knowing if your care provider respects your decision. Equally important to note that midwives that work in a medical setting, like a hospital setting, can provide more medical intervention during your labor. So if you're wanting an epidural, you can still have a midwife in a hospital birth with an epidural or with Pitocin. So a certified nurse midwife that's in a hospital setting, she has access to those things and can use those during your birth. As mentioned, I feel that a birth is not a medical event and don't feel like I need those things, which brings us to choosing a provider. It is very important to think about what it is that you want during your pregnancy, labor, and birth, and to educate yourself on the entire process, on possible scenarios, on what you want as a birth plan. Because when you know these things, you can compare them with your provider's philosophy or beliefs and see if they're aligned or at least respected, so that you can make informed decisions and not be coerced or made to feel bad for your decisions, or get any surprises at the end where all of a sudden your provider is like, I'm not on board with that. So it's really important to understand what you want and the deep beliefs of the provider that you're choosing. Educate yourself, because when you do, you'll be more confident, you'll be less fearful, you'll have better conversations, especially with care providers. They'll know that you know what you're talking about, and you can make better informed decisions that way. It's important to interview your care provider, find out about their training and their background, and if hiring a midwife, definitely find out what their training and experience is. And it's important that they disclose to you what type of midwife they are, what training they have completed, so that you're able to make an informed decision and choose the right provider for what you're looking for. So it is important to note that when choosing an OBGYN, that OBGYN will not be there to support you and guide you during your laboring process. The OBGYN generally shows up when it's time to push or when it's time for a C-section. Typically, the labor and delivery nurses will be there to support you during your laboring process, but that care will be intermittent because obviously there are other patients in labor on the delivery floor as well. So they'll be in and out of the room. And that might be where it's a good idea to hire like a doula, which is a support person during your labor and birth. And then typically with prenatals, if you have an OBGYN, you're not going to see them usually every prenatal appointment. Usually you'll see the nurse practitioner, and once in a while you may see the OBGYN. So your visits aren't going to be as personalized. You're not going to get to know your OBGYN on a more personal level. Your visits are going to be shorter for prenatals because you're basically just, taking urine, getting measured, getting weighed. They're not really going to dive in depth with you on nutrition or fears, for example, anxiety leading up to the birth, how your home life is going, things like that. they are not really going to touch on. And again, this is a generalization based off of my own experiences and being a doula and seeing the difference in care from OBGYNs to midwives. On the other hand, a midwife during the laboring process is going to be there for as much of that as you want them to. So if you're in active labor, your midwife can certainly be with you during that time, especially if you're in a birth center. If you're in a home birth, then you can leave that up to your discretion on when you want to call your midwife over in the process. So that may be for support for the entire labor, or you may be a more private person that enjoys little or to no intervention, like myself, who doesn't call the midwife until I am pushing. As far as prenatals, again, it's more personalized. With a midwife, your prenatal visits are going to be longer. They're going to be more family centered. So if dad is involved in attending prenatals, or siblings, then maybe they're more hands-on with the family, teaching them how to find the heartbeat of the baby with the Doppler, teaching them how to measure your fundal height. It's more family-centered. It's also going to be talking about, exercise, nutrition, your mental and emotional well-being, what's going on in your family life, because that midwifery model of care is physiological, and they believe it's a biological process. So all of those things surrounding the pregnancy and the labor directly affect it. So your family life, your emotional well-being, your nutrition, whether you're being active, all of those things will directly affect your labor and birth and the outcome. So they're invested in those things more so than the medical management model, where we're more so testing and monitoring to see if we can find any complications. I do also want to mention, if you are considered a higher risk pregnancy, or maybe you have pre-existing conditions and you feel like you would love to have a midwife, but maybe you're not a good candidate for it, or maybe you don't think you would qualify for that type of care, I still encourage you to interview and talk to midwives in your community. A lot of certified nurse midwives and even certified midwives are trained in higher risk pregnancies and will take on high risk pregnancy clients. And they have the ability to either transfer your care out. Say you have a pre-existing condition that ends up being a problem during pregnancy, they can transfer your care to an OBGYN if that ends up being the case. They can also do co-care. So if you have a midwife who's doing co-care with an OBGYN, just to get that extra support and that extra knowledge to safely manage your pregnancy with you, then that's an option. They can also do co-care with other midwives in the community that may have training with that certain condition, or specialize in that high-risk pregnancy category, whatever that may be. So there are options, and I don't want you to single yourself out or close that door if having a midwife is what you envisioned, but you're thinking that there's something that can hold you back regarding, your weight or your health or something like that. So I encourage you to interview midwives in your area and see what's out there. Interview midwives, see what their training and their expertise is, because that is definitely still an option for you if that's something that you're wanting. I also want to say that if you're not comfortable with a birthing center or a home birth, there are many midwives that help women in a hospital setting. So if a hospital setting makes you feel more comfortable for your experience, then you can usually always find midwives in hospitals nowadays, and they're covered by insurance, which is an added bonus. So that's also an option, but I just want to kind of put these options out there because there are so many different options that women have, so that they can safely experience the birth that they've envisioned. Likewise, there's OBGYNs that have reputations for being more natural-minded, so that's also an option. You can still have that natural, unmedicated birth that you're imagining in a place that makes you feel safe. If a hospital is what that is for you, then you have those options. I would ask around to mom groups and communities and even hospitals. The nurses will know, which OBGYNs are more natural minded and respectful of unmedicated births or minimal interventions, and who are more inclined to recommend interventions and epidurals and things like that. So no matter what it is you want, figure out what that is, and I promise you there's going to be an option for you to have the birth that you've envisioned, no matter where that's at and what it looks like. You'll be able to have that. If you have any questions regarding the state where you live and trying to find care providers in your state, whether it be a midwife or an OBGYN, you can comment below and I will be more than happy to send you resources to be able to locate what it is that you're looking for your birth that you've envisioned. And again, because I believe this is the most important piece of not only choosing a provider, but just being pregnant, planning an upcoming labor and childbirth, is educate yourself. Do not rely or depend on any care provider to have all the answers for you. You must educate yourself so that you're able to make informed decisions, so that you're able to be confident, so that you're knowing what it is that you want. So no matter what provider or what birth setting you choose, just make sure that you're educating yourself so that you're choosing the best options for you and your baby and your family. Knowledge is power. Comment below on what care provider you've used in the past for previous pregnancies and what your experience was like. If you're currently pregnant or you're choosing a provider now, let me know what you're going with and what you're most excited about. Don't forget to like and subscribe if you've enjoyed this video, and hopefully you've taken something from it. I look forward to seeing you guys next time. Bye-bye.